Assalamualaikum and good day everyone. This video session is to brief about using the investigation for radiology. You need to ensure that your patient has registered at the counter, and when the patient is in, go to the progress notes and click the sign in patient button. You need to do this before you request for the radiology. Okay, and then go to the examination and diagnosis. Click the investigation menu on your left and then click radiology. Alright, so this is your investigation table for radiology. This button will shows up when the patient is signed in. Okay, it will not show up if the patient is not signed in or not registered. Alright, now you can click this button, request radiology examination, and this form will come up and you need to fill all the necessaries. Okay, if it is urgent, you can click yes. If it is not, just click no. If the female patient, please do ask them whether they are pregnant or not, and then this is expected pregnancy end. And then we have isolation precautions. This is for those who have especially airborne risk or airborne disease risk. Okay, and if the patient has allergies, this is definitely for the contrast, especially for the iodine. Okay, and if the patient require any transfer or any mechanical lift for the x-ray, if it is not, you just type nil. Okay, or you can type if it is not, then you can type for wheelchair, perhaps a wheelchair or something like a lift. Okay, mechanical lift, so something like that. So for now I'm just going to put nil, and then whether the patient is ambulatory, wheelchair, stretcher, oxygen or on the portable mobile devices. If it's not, just click ambulatory. And the next section is for the research. If the patient is coming for radiology due to research, put the ethics approval number. If it is fee exemption paid by the grant, just click yes and then do specify which grant type and how it's going to be paid. Okay, I'm just going to click no. And then for the clinical summary, brief clinical summary, you just type whatever the radiologists need to know. Okay, I'm just gonna do this. And then anatomy region of interest. If you are doing OPG, maybe you put both for maxilla and mandible. If you're doing specific IOPA, you can click either one, TMJ or by quadrant, or you can just specify. And then for differential diagnosis, please do put whatever you think of. And then if the patient has previous imaging, click yes. If no, then click no. And then for the diagnostic objective, please do choose one of these options. Okay, I'm just going to do this, impacted tooth evaluation. And then this is the important one. Click the radiograph type that you need to do. I'm going to do the OPG. Alright, and then if you request for report, click yes. If it is no, no, and click add. However, you can actually choose a different modalities. You just need to add here. Okay, so in one form you can request more than one radiograph type. So for the next one, I'm just going to show you for the IOPA, which is intraoral examination. Just choose this one, and then this one will require you to select the tooth number. Okay, I'm just going to do tooth number 24, and that's it. Okay, If you have special notes for the radiographer to read or to know, or even radiologist to know, please do put anything. All right, and some of your screen may not have this last table, which is field of view. Some of you may. This is only for use of our radiographers or radiologists. Okay, and if you're done, you click submit. It will not allow you to submit if you have not filled any compulsory field. And then click submit. Click yes, and you are done. Okay, so your request will come up here in two separate rows because you have requested two. So the system automatically segregate it into two different rows, because every row will have a different image for different type of radiograph or radiology image. All right, so for lecturers, you will need to verify this for the students. For lecturers itself who requested, it will be automatically approved. All right, only for CBCT that the radiologist will see the request and approve. All right, so for the students, it has to be approved by the lecturers. However, for the lecturers itself or specialists, they don't need to have approval from anyone except for CBCT. Okay, and later on, what we call this, the radiographer may have uploaded all the images that you have requested. You can view over here, and also the student can put the interpretation around in this column as well. All right. If you want to upload the image, you can click this purple button to add image of the X-ray, and you just put a file name and then choose file and add image. Okay, so that's how you upload the image. And if you want to upload the interpretation, click the yellow button, put the interpretation, diagnosis, and if you have remark, put the remark and save button. Okay, if you want to generate a report, you can click generate a report. This one will actually only appears to those who have radiologist account. Right, I'm just going to cancel that. If you want to view the form again, you can click the blue button and your form will shows up here what you have done. Okay, and you can actually update the form. All right, so that is about radiology request. Thank you.